The use of dexrazoxane was a bit conflictual for some years because of some restrictions in terms of label raised by EMA and the FDA. Actually, this is one of the different options we have in hand to counteract the side effects of on the heart of anthrocyclines, which are really strongly potentially toxic, but also at the same time strongly active in many diseases, solid tumors as well as hematological malignancies. What is difficult with anthrocyclines is that from the beginning, from the first milligrams that you use in a patient, you hit myocytes and you create kind of damages, but which are irreversible and which start very, very early. And it's a bit like frailty in the older patients. It takes time to unveil really what happens. And so that doesn't mean that because you do not assess any practical consequences on the left ventricular ejection fraction that you do not have any damage. And so any attempt to prevent or to limit this kind of side effects is important. Dexrazoxane is one of such possibilities. You have other ones, like long infusions, like cardioprotectors as well. Controlling the high blood pressure is also a very big point. But what is true is that some of these preventive measures are easier to handle than others. And dexrazoxane is really something which is easy. It's indexed according to the dose of anthrocyclines that you use, and it has been it's very active. It's very productive in terms of protection. The concern, which has been long in the mind of oncologists, was does it affect the efficacy of the chemotherapy? But there again, the last update in terms of data provided to EMA, submitted to EMA, shows that this kind of concerns do not exist anymore. So there is it was a big relief in terms of use. I don't expect that it's going to change immediately the way we use it, because it takes time. We got habits. Maybe it's a wrong attitude because there are still very important drugs, these anthrocyclines, but I would say that it will take a bit of time. And for the elderly population, it's clearly something which is important because of the higher sensitivity of the heart and the cardiac function to this kind of damage. Well, I think when you consider that almost 30 to 40% of patients older than 65 have high blood pressure, and that it's the first risk factor for cardiac failure. I mean, it is really there is it's a wide volume of patients who are potential candidates for such preventive measures. And what is really intriguing is that you have some meta-analyses which have investigated the role for such preventive measures in terms of cardiac issues, and they've shown that it works quite well. Why do we not use that more often? That's certainly questioning the way we analyze literature, especially for the elderly. I would say that certainly because of that, older than 65 to 70 women or men requiring the use of doxorubicin for lymphomas, breast cancer, or other disease, really are very good candidates to avoid the development of such failure, which when it happens is really one of the one which has the worst prognosis in terms of issue. You do not cure, you do not catch up, you do not, this kind of situation when it happens. That's, and the global outcome is 1 year of survival behind this kind of cardiac failure induced by anthrocyclines. Well, I would say that we do not have, as I said, we do not have a very good signal or sentinel diagnostic tool to identify the damage that we create upfront with the use of anthrocyclines. And that's what makes the slippery into cardiac failure so touchy and difficult, tricky to screen for. So any use of anthrocyclines should really put clearly in mind, we should hold that in mind, the balance between benefit and risk that we take. And I would say, given the high predisposition of older patients, older people to cardiac failure, it should be considered much more often than what we do. And dexrazoxane is really not doesn't have any safety issue or activity issue on the anti-tumor efficacy of the treatment. So I don't see any reason why it shouldn't be considered more often.